as they're getting better, we can ask them to get dressed and they recover quicker and they gain the confidence and get better and go home.
I think it's also to do with the clothes that they pack to bring in, practical clothes, baggy t-shirts, trousers that haven't got too many buttons, and really loose clothing. Shoes with Velcro on are really handy to have, because some people's feet and legs swell up and become quite edematous. So things that can be adjusted for that patient, so that sort of trying to get the public or the people who pack the bags for the patient to understand what they're coming in for and what is practical for them to wear.
So is this being particularly aimed at older patients then, John?
Not necessarily. The older generation, sometimes, I'm not going to tar them all with a brush, because that's not, we don't do that, but it's a case of sometimes they assume the role of that patient, and when they might come into the hospital at 3:00 in the afternoon, and the first thing they do is they think, oh, I'm going to convalesce, so they put their pyjamas on. And I think that's, to a point, an old-fashioned way of looking at when, that generation came into hospital. They were there to be looked after and convalesce and put that on, and we're trying to break that chain a little bit.
Yeah, the benefits also is we get fewer pressure injuries, because people have got their own clothes on, their own shoes, they're mobilising, they're not laid in bed, creating pressure areas, so it's all positive.
And I suppose if somebody's up and dressed in their own clothes, they feel more like moving around generally. And is that encouraged as well? Are they able to move around the hospital?
We've got lovely gardens at Nobles. So they get up and dressed and have a wander in the garden and go to the coffee shop with their relatives. And one lady, she'd had been very ill, and we said we're bringing this concept into her daughter, and she said, oh, my mum loves to get dressed. She fetched her clothes in, we did her hair, we put some rollers in, we set her hair, she got dressed, went down the coffee shop, and she said, I feel more like me now, my confidence is back, I'm ready to go.
I should say that's probably not often that you have time to do people's hair.
No, we don't, but we do.
But that's so lovely, though, because Wendy, there's some really startling statistics about the implications that there are for patients, particularly over the age of 80, for just staying in bed.
If you're over 80 and you stay in bed for a week, you actually get 10 years worth of muscle wasting.
That is incredible.
It's amazing, isn't it? So that's why people lose their confidence with mobilising and so forth, because they do feel weaker, they feel dizzy when they get up, they've got less strength. So it's absolutely vital we try and keep them moving.
And while we're on the subject of the elderly, we were talking as well about the interesting sort of benefits of making sure that you don't necessarily put your pyjamas on at different times of day, because it can affect dementia patients. Just explain that for us.
Well, dementia patients, if they're in the pyjamas all day, they can't differentiate between night and day. So, they get the confusion is added to. So if we get them up and dressed and ready for the day, they know it's breakfast time and dinner time, etc. Then when it's night time, we put the pyjamas back on, they know it's time to go to sleep, they get the rest they need, and everything's wonderful.
Do you know, it makes absolute sense when you say it, but I mean, I think we've all had that image of, if you had to go into hospital, you would automatically take your pyjamas with you, because that's kind of what you've always done. But this is just changing a mindset, really, Wendy.
Yeah, we do have a ward. We've got wards 11 and 12, which is orthopaedics, and they actually do get the patients up and dressed, and it's part of the re-enablement programme, and they do fantastically. So in a way, we're following them. But this is also a campaign that's going on in the UK as well. It's recognised throughout the UK. It's an important thing to do.